The scalp extends from supraorbital margin anteriorly to the external occipital protuberance and highest nuchal line posteriorly, and laterally is bounded by zygomatic arch. The layers of the scalp can be denoted by its alphabets: S for skin, C for connective tissue, A for aponeurosis, L for loose areolar tissue, and P for pericranium. The skin is the thickest, hairiest, and has the most spacious glands. That's why it's more prone to sebaceous cysts. The dense connective tissue layer is very vascular, hence, any injury to this layer causes profuse bleeding. This dense connective tissue layer joins the skin, the upper layer, to the lower layer, which is aponeurosis and the muscles, making the upper three layers to move as one unit on the below loose areolar tissue. The aponeurosis is also called the epicranial aponeurosis or galla aponeurotica, and here the occipital frontalis muscle originates, supplied by the facial nerve. This muscle has two parts: frontalis part, which elevates the eyebrows and is present anteriorly and is responsible for the wrinkles on the forehead, and the occipitalis part, which pulls on the scalp posteriorly. The loose areolar tissue layer is sponge-like and can distend in the presence of infection or bleeding. In case of bleeding below this layer, it can extend into eye and cause a black eye. This layer is also known as the danger zone area of the scalp, as infection from this layer can spread via emissary veins into the intracranial sinuses. The periosteum is loosely attached to the skull and can easily be stripped off in subperiosteal hematoma. The arteries and the nerves run together. The supratrochlear and the supraorbital are branches of internal carotid, and the superficial temporal, posterior auricular, and occipital are branches of external carotid supplying the scalp. The nerves include supratrochlear, supraorbital, zygomatic temporal, auricotemporal, lesser occipital, and the greater occipital nerves. Every artery has a respective vein traveling with it. The supratrochlear and supraorbital drain into the facial vein. The supratemporal and occipital drain into the vertebral vein, and the posterior auricle drains into the external jugular vein.